Thank you very much, Chris. Thank you for this opportunity you offer me to present. I am Kenfack Josiane, a PhD student in the University of Yaoundé 1 in Cameroon, and this presentation is a part of my PhD. So my presentation is titled The Leke Project, Raising Awareness on Vaginal Health in Cameroon. This presentation will follow three main steps: the description of the Leke project and the study site, and the description of the project implementation. So what is the Leke project? The Leke project was inspired by Isala. As we certainly know, Isala is a Belgian citizen science project aimed to better understand the female microbiome and presence of lactobacillus in healthy women. In the case of the Leke project, we have two great objectives. First, in the scientific level, we wanted to characterize the vaginal microbiome of healthy women in rural area and in urban area, and also identify various lifestyle and environmental factors that can influence the vaginal microbiome. We wanted also on the societal level to raise awareness about vaginal health and healthy practices, and empower women to take their vaginal health into their own hand and break the taboo on this intimate topic. In the case of this presentation, I will focalize on what we did in the rural area. Our studies took place in Cameroon, especially in Gunugu. Gunugu is a village, is a remote village located in the north of Cameroon. It's a very conservative village. People live there in community. They have wholly the same lifestyle, same eating practice, eating habit. They eat vegetables, fruit, fish, and cereal. Gonogo is a patriarchal society. It means that in this village, men is the head of the family. Men take any decision. Women can't do nothing without have authorization from the men. Even if you want to talk to the woman, you need to have first authorization from the men. It's also a very conservative society village, because some topics are very taboo. For example, if you want to talk about sexuality or vaginal health, it's extremely taboo even to talk in the familiar circle. So our big challenge was to break this taboo and engage in discussion. As you know, vaginal health is very important to talk about this topic. We begin our study by the identification of the study site. This was done by the network pre-established as CREME. CREME is the lab where I'm working in Yaoundé. Yaoundé is a city of Cameroon. And then after that, we obtain all necessary administrative procedure, like ethical approval is very important, and also approval for the health ministry. But after all these documents, we decided to move to the study site. It was a very long journey because we have to travel 24 hours by car and by motorbike to reach to the study site. Once we arrive in the study site, the first thing we do is to meet the chief of the village. As I told you, it's a very conservative and patriarchal society. It was important for us first to talk to the chief of the village, to explain the project, the importance of the project, and also to have his authorization to implement the project in the village. And also what we want is that we wanted that the chief of the village talk to the men to allow us to do the study. So after that, we have a meeting with the medical staff and community workers. Community workers are people who are in contact with the local population and whom they trust. Generally, we find the community workers in the remote place. So they are in contact with the population trust them, and it was very important for the success of this project. They introduce us to the population. So when we work with us, the population And what we do is that we have a discussion with the medical staff and the community workers. We wanted to know their experiences with the population concerning the human health, the difficulty, and we share our knowledge concerning the good vaginal practices, and also we train them about various subjects and also about vaginal samples collection. So after that, we go to our big challenge. That was to have a discussion. It was not easy because talking about sexuality, talking about vaginal health, even in the family is forbidden. So it was a big challenge for us to talk publicly about all these topics. And we have the help of the village chief, of the community worker. And also what we did is that we present the advantage that the project will bring to the women. As we know, vaginal microbiome play a critical role in human health. So we explain to the men that as they are the head of the family, it's important for them to take care of their women. And taking care of women is also to mention that the woman is in good health, because if the woman is not in good health, they will not do what they are supposed to do. So thank you. The discussion was very good. The men was they understand us. They ask questions. They was very participant. They ask what they have to do to help their women to keep a good health. So after that, after having authorization of the men, we have a discussion with a woman. We have a free discussion. We answer all their questions they have about vaginal health. We also talk about vaginal health good practices, because before coming in this hospital, we have a discussion with the community workers. So we identify something that women was doing that was not good. So we explained to them that if you did this, it's not good for your vaginal health. You have to do this. So it was a very good discussion that we have with the women. And after that, we explained our vaginal research, and women who were eligible to our criteria and wanted to participate and sign the informed consent, we sampled their vaginal swab for characterize the vaginal microbiome. One big challenge we had also, it was sample transportation and sample storage, because the village didn't have facility to keep samples in a good condition. So it was a very big challenge for us, because we had every after sample collection, to take the sample to go to another town to conserve the sample. And this nurse in the back, she was very helpful. She very helped us to do that. And concerning the sample storage, what we did, we made some local ice. We take a plastic, we put water inside, and we put in the fridge. So after that, we take the ice to conserve the sample before transportation. It was a very nice experience, because villagers were very kind and ready to help us. It was very, very kind. In conclusion, the Leke Project, for the first step, was a great adventure. I say the first step because the project is ongoing. We also want to map the vaginal microbiome of healthy women in the urban area. In urban area in Cameroon is more diverse in terms of ethnic group. I forgot to mention that in the Gunugu, we have only 2 ethnic groups among the 10 ethnic groups you can find in Cameroon. So in the urban area, you have all those groups. You have different hygiene, different eating habits. So we wanted also to map the vaginal microbiome of women there. We also want to map the vaginal microbiome of pregnant women, HIV positive. As you also know, HIV is a public health problem in Cameroon. So the project is ongoing. In conclusion, we also say that all the challenges we had, we overcome those challenges thanks to the dynamic of our team, and also because we also implicate all the villagers, because when you come in a new place, it's important to work with community workers, village chef, the head of the hospital. They was very useful for the success of this project. I would like to thank first the Biocodex Foundation give us the fund that allow us to do this project. I will also thank the Sahara Libre Lab, the Lab of Applied Microbiology and Biotechnology, and also thank all the team in Cameroon, and also very thankful for the community workers, the village chef, and also the medical staff. Thank you very much for your kind attention.